It's the way Singapore wakes up. Wake up, Glenn, Angel, and the Flying Dutchman. Wake up in the morning feeling like Kiss 92's Big Show.
Good morning, Singapore. Your Wednesdays right here on Kiss 92 will never be the same again because it's Good Morning Doctor time, and our very first doctor to join us on this wonderful, wonderful segment, once again, every Wednesday at this time on The Big Show and The Big Show TV, is family physician from Parkway Shenton, Dr. Daniel Chow.
Morning, doctor.
Did you like that introduction?
Yeah, I love it.
Very game show, right?
Yeah, that's right. Good morning, everybody, all the listeners out there.
Good morning.
Yeah.
If you want to watch us on the Big Show TV, remember you can head to our Facebook and YouTube channel /Kiss92FM.
And also drop in your questions if you have any questions for the doctor. We'll try and deal with as many as we possibly can. This morning we're dealing with high blood pressure, cholesterol, and that wonderful topic, healthier SG, which I think is really good. First of all, though, what is hypertension really?
Okay, hypertension is always expressed it's elevated blood pressure in the blood vessel, specifically the arteries. When we talk about hypertension, blood pressure, we always report it as two numbers. Remember, it's two numbers. The first number, which is the higher number, is the systolic blood pressure. That indicates the pressure in the arteries when the heart contracts.
Okay.
And the lower number is the diastolic blood pressure, which indicates the pressure in the arteries when the heart relaxes in between contractions.
So it's in, out, in, out. Is that what you mean? Right.
That's
Okay.
right.
Okay.
That's
It's very hard to determine if it's chronic or not, unless, of course, you have maybe a device that you can observe. Because I think during different times of the day, your blood pressure levels are different, right?
Yes, that's right.
If I go out there and I see a pretty girl, boom, my blood pressure goes up. If I get angry, my blood pressure goes up.
Yes.
If I'm extremely relaxed, my blood pressure goes down.
Yeah.
Yes,
So
yes.
how do we determine?
So what we do is that, okay, first you got to understand first. So you have these two numbers, right? So at what number, what's the cutoff value that you use to determine hypertension? Okay, so if your systolic blood pressure is at 140 or more, or your diastolic blood pressure is 90 or more, then you are diagnosed as hypertension. You have hypertension.
Okay.
And we would like this blood pressure to be measured over multiple clinic visits. Multiple, because like what you said, maybe your first visit to the doctor, you may be a little bit excited.
White coat syndrome,
yeah,
right?
maybe you had a quarrel with a quarrel with your wife in the morning.
Yeah.
Or something stressful. Yeah, so you want to come back a few times, or maybe we will let you rest for a while, and then we'll check again. And if you measured a few times and it's still persistently above 140/90, that's how we report it. 140/90, for example.
Yeah.
Yeah, then I think it's very likely that you have hypertension.
Yeah.
So should we have our own blood pressure machines at home to kind of monitor our own situations?
Yes, I will encourage that.
Okay.
I will encourage
All right.
that. Yes.
Okay.
How often
Yeah.
should we do that monitoring?
Okay. If you do not have any history of hypertension, then if you have a machine at home, you can measure as often as you want. Yeah. But I think maybe for a start, what you do is that you measure every day, twice a day. Twice a day, once in the morning, once in the evening. And you measure every day, consecutively for 7 days.
Okay.
And after that, you just discard the first day because maybe, first day, maybe you're a little bit excited about it.
Yeah.
So, yeah, that's right. So
Okay.
you just take the readings from the second day onwards to the last day, and you average it out.
Oh, right. Okay.
Okay, now just let me. Okay, there's a little bit difference when you measure the blood pressure at home, because studies have shown that the blood pressure when you measure at home is almost always lower than when you measure it at a clinic or in a hospital.
Because you're a bit anxious at the hospital.
Exactly. Yeah. So according to MOH clinical practice guidelines, the cutoff point for measuring at home is 135/85.
Okay.
Yeah, that means your average, remember it's average. So you might see some readings will be higher, lower. When you take the average, your average should be less than 135/85. That's a home blood pressure monitoring.
Okay.
Okay.
All right.
All
Okay.
right. We are speaking to Dr. Daniel Chow, family physician from Parkway Shenton. We'll continue this conversation on the Big Show TV. I want to ask the doctor if the average is the same for guys as it is for girls.
Good question.
Yeah.
All right. But right now, here's Dua Lipa. There. My blood pressure is going up already right now. Physical on Kiss 92.
Okay.
So what's the average for reading for a man and a woman? Because for most people, it's 120 over 80, right?
No, it's the same. There's no magic number.
Okay.
Yeah.
Oh.
There's no perfect reading.
There's no perfect reading. There's not. I must aim for this. I have a lot of patients are telling me that. Okay, yeah, just stick to 140/90 as the definition.
140.
Oh,
Yeah,
140/90.
that's measured at the clinical setting in a clinic in a healthcare profession.
Right.
Yeah, just stick that because that's the cutoff point that MOH uses, and it also follows the WHO classification.
Okay.
I see.
Yeah. But if you're
I
managing
see.
at home, then you just take your average and just maintain it below 135/85. And
135/85.
anytime it's above, you see your average is above 135/85, then just consult your doctor to get confirmation.
Okay. Okay. So,
Okay.
all right. So our 135/85 is the doctor's 140/90.
That's right.
Yeah.
Okay.
Okay.
All right.
Okay.
Okay.
That is very interesting.
Okay.
'cause
So
I didn't realize
high
that.
blood pressure comes under chronic disease.
That's right.
Chronic disease. And we were also talking about
High cholesterol.
High
High cholesterol.
cholesterol. Now, I recently went for a full health checkup, blood test, everything. Everything
Yeah.
was done. And everything pink of health, except he said I was borderline high cholesterol.
Can you remember the value?
No, I can't remember the value, but I can look it up, but I can't remember the value now.
Okay.
But I know cholesterol usually comes from eating meats and stuff like that,
Yeah,
right?
yeah.
Because I'm vegetarian. Apart from a couple of eggs and some cheese, everything else is plant-based.
Some of she
Where
used to
d-
be vegan.
vegan.
Yeah.
Yeah, right now I'm vegetarian. But where does the cholesterol come from then?
Okay, very good question. Yes, I get asked that quite a bit too. Yeah. Okay. So first of all, there are actually few answers to that query. Okay, cholesterol actually is produced endogenously. That means majority of it, 70 to 80% of cholesterol in our body is actually produced by the liver, and
Okay.
only the rest, minority, is actually absorbed from the food that we eat.
Okay.
Yeah. So why do we need to produce cholesterol? Because we need it. Our body needs to make sex hormones, vitamin D's, and to make bile acids.
Right.
So yeah, I have seen vegetarians that have high cholesterol
Yeah.
because it's actually a disorder in the metabolism. That's first
Oh.
reason. Second reason, so it's not just due to the food. Of course, second reason is that, like what you mentioned, you can get cholesterol from non-meat source. I mean, as in like eggs,
Right. Okay.
yeah, seafood.
Alcohol? No.
We'll talk about that later. Yeah,
That's a whole segment for you.
Yeah, just
Yeah.
just
No, I was
also-
thinking about you because
me.
I mean, you love
I
your
enjoy
wines
my
and-
drinks.
Yeah.
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 and
do.
also you when you eat food that are high in saturated fats,
Yeah.
that will also increase your cholesterol, and this includes things that make they're rich in palm oil and coconut oil, coconut.
I do
cream,
like my fried food.
coconut milk.
So that would be it. right?
Yeah, that depends to the oil they use. Yeah, a lot of
So,
snacks.
so the
have,
fried it depends on the oil only.
the oil and also the
you're
ingredient.
frying,
yeah,
yeah.
that's right. Yeah.
Okay. What about processed food? Does that contribute as well? Highly processed foods.
Processed food. I presume you're referring to food that's salted.
Okay. Yes.
Because everything is
Yeah.
processed.
Yeah,
these
That
days.
is that's probably under hypertension. But yeah, I mean processed food. Yeah, a lot of snacks out there like chips, biscuits. They have they use palm oil as one of the ingredients.
Right.
Right.
Okay.
Yeah.
So palm oil is something to
That's
stay
right.
away from.
Yeah, that's right.
So the question we've talked hypertension, we talked high cholesterol. Does one automatically come with the other? So if I have hypertension, does that mean I'll have high cholesterol? If I have high cholesterol, will I have hypertension?
No, not necessary. Not necessary. But the two are pretty common. So you do find people who have both. coexisting,
Right.
And that when that happens, actually your risk of cardiovascular events increases that much more. So you got to be careful.
I think that's a
Okay.
nightmare for Singaporeans, having high cholesterol. And you know why? Because we enjoy our food
Food,
so much.
yeah.
The moment you have high cholesterol, you got to start watching what you eat. That's it.
Yeah.
When I'm on treatment for, say, something like high cholesterol, am I continuously on treatment or is there a point where I'll be able to stop it?
No, you are continuously on treatment. But when we say treatment, it doesn't mean it's always have to be just medication. It's a combination of diet, lifestyle interventions, and medication, and I would emphasize continual follow-up with your doctor.
Does the medication ever stop though?
Generally, no. I think the short answer to that is no.
For cholesterol? Is it? Are you talking about cholesterol?
For cholesterol.
Yeah, for cholesterol.
What, for the
generally.
rest of your life?
Yeah, when the doctor will make the decision. You just check with your own doctor. But generally, we when we start, there's a good reason we start. Yeah, for me, I would if the cholesterol is not very high, you're not a very high risk patient. That means you do not have any pre-existing disease. You don't smoke. You're not obese, things like that. Okay, you're not high risk patients. You do not have any other cardiovascular disease. And your cholesterol is like borderline or just slightly raised. I will give you a trial of just non-pharmacological measures like diet and lifestyle intervention. And I find that patients who do make an effort to make changes to their life, they can bring the cholesterol down.
Okay.
They don't really have to be on medication. But having said that, after the cholesterol has come down, has normalized, you should still continue your follow-up with your doctor, because as you age, your cholesterol, just slowly creeps up, kind of thing.
Yeah. But for those that have to stay on their medication lifelong,
Yes.
you would still recommend your diet changes, your lifestyle changes, and all that.
Certainly.
Does that bring the numbers down?
Yes, that helps too.
Dramatically?
A little bit helps. Yeah. That's right.
Why is it like that? I would have thought I opt to take medication so that I can
can do
continue
anything.
to
Oh no, you can't.
You can't,
to
right?
lead my normal life. You know what I mean?
No, you
Okay,
can't.
the reason for that is because why would we ask you to continue with all the changes? Because those changes that you're going to make not just affect your cholesterol, but it improves your overall health. Yeah.
Okay.
All right, we're going back on the radio in just a while, okay? And I think I'm going to cover that. Does someone need to be on lifelong medication for
Yeah,
cholesterol?
we need to.
Does someone have to be on lifelong medication for hypertension as
Hypertension
well?
as
We'll ask you
Yes.
both questions again when we go on the radio. But I mean, it's still live now. Hello.
Hi.
Hi, everyone. YouTube, Facebook, audio. Okay.
Kiss 92 traffic.
If you're on the roads, look out on the KPE towards the ECP right before the Nickel Highway exit. Avoid lane 3. An accident has been reported. Wherever you are today, stay safe.
Good morning, Singapore, and welcome back to Good Morning Doctor. We have with us family physician from Parkway Shenton, Dr. Daniel Chow, and we're talking about chronic disease management, namely high blood pressure as well as high cholesterol, as well as healthy SG. We'll go into healthy SG in just a while. But we were talking about this on the Big Show TV earlier, Dr. Chow, medication. So when someone starts off with high cholesterol medication, can they get off the medication at some point? And does it also apply perhaps maybe to the same question applies to hypertension?
Well, I think the short answer to that, generally speaking, we don't stop the medication. There's usually a good reason why the doctor will start medication. The doctor will assess you, and if you need to be on medication, usually it needs to be lifelong. Yeah, there's some cases where, for example, for me, if I find that the patient is low risk, that means you do not have any pre-existing cardiovascular diseases. You have no risk factors, like you don't smoke, you're not obese, your lifestyle is quite healthy, you're not sedentary, then and your cholesterol is not high, maybe it's borderline, it's borderline or just slightly raised, then I might just give you a trial of diet and lifestyle intervention. And I find that patients who make an effort to make changes to their life are able to bring the cholesterol down normal.
Okay.
But having said that, even when it's back to normal, you should still continue to follow up with your doctor to check it again. Yes.
Okay. You have something from
Then we
Facebook?
have very bad examples like the Flying Dutchman, for example, who doesn't care.
That's
You know,
true.
what he eats, what he does, and all that. And still, wow, look at him.
Yeah.
He's in pink, in the pink of health right now in his
I
Kiss
only look
92
pink
t-shirt.
because I got the pink t-shirt on. But we do have a lot of questions on our Facebook, and I just want to throw a couple of them to you. Albert has said, I'm on Zestril, 5 milligrams. My BP is 140/60. Should I continue taking 5 milligrams?
You should
Consultation costs $50, by the way.
Yeah, you should keep it below 140. But it's about risk. The game is about risk reduction. So I don't know what's your medical history like. Do you have any past coexisting medical condition? So it's a bit difficult for me to comment. But just consult your doctor. Yeah. But I think at a minimum, you should be below 140/90 if it's measured at the clinic.
Okay.
But your doctor may have a lower target for you if you are high risk.
Right.
What's the guy's name? The guy who asked the question?
Albert.
Okay,
Albert,
we'll
okay.
charge $15.
Okay, $15.
That was like,
Yeah,
50
pay now.
seconds.
Yeah. There are a lot. Angie comes up and says, my LDL is 155. My HDL is normal. Do I need medication?
Okay. In deciding whether to initiate cholesterol medication is a little bit more complex. I think this is the job of a doctor. So the doctor will assess again what's your risk status. Based on all the risk factors that I mentioned earlier, and then we'll decide what is your target LDL level.
Yeah.
And then from there we decide whether you should start.
So don't
medication.
try and guess it yourself.
Yeah, no, I think
Yeah.
we need to be aware as well
Yeah.
that with questions like these,
need
Dr.
to go
Chow
to your
needs
own
to
doctor.
know
Yeah.
the history, whether there are any comorbidities and
Yeah.
stuff
Yeah,
like that
yeah.
for your health. But I did want to ask something about side effects of medication since they're lifelong. We can do that on the Big Show
on
TV.
the Big Show TV. But keep those questions coming in on Facebook, okay? We like that. We like that a lot. And if the doctor can answer your
answer it,
questions,
he
he
will.
will. If not, then you got to go out there and
Find
maybe
your
see
own
someone
doctor.
else, or look for Dr. Daniel Chow, who's with Parkway
Absolutely.
Shenton. All right, it is 8:17.
Kiss 92 Time Check brought to you.
So, doctor, you were saying some of this medication can be lifelong.
Yep.
What are the side? There must be some side effects to the medication.
Okay, for hypertensive medication, there's just too many to
Oh,
talk
wow.
about. Yeah,
Okay.
so I think that's quite a big. Generally, medications are safe, and side effects are actually not common.
Okay.
Yeah.
But if
I'll
there
just-
were any, what would you
Yeah,
what are they?
yeah. Maybe we'll just talk about statin, which is the most commonly prescribed medication for
Okay.
cholesterol. So the most common side effect that I see actually is muscle-related complaints like muscle ache, muscle cramps, things like that. And the incidence reported ranges from 1 to 10%. Yeah, and most of the time it's pretty harmless. It doesn't cause any permanent damage. Yeah, so if you do experience any side effects for that matter, please consult a doctor so that the doctor can assess and decide whether you need to change or stop the medication or even just reduce the dose.
Okay.
Because there are alternatives to statins,
Oh, certainly.
right?
Yeah.
Okay.
Yeah.
Speaking of alternatives, are there any natural or alternative remedies that people who might be watching and listening want to do instead of taking the pharmaceutical drugs?
Yeah. Okay. As far as I know, I do not know of any supplements that can control blood pressure.
Okay.
Yeah. So cholesterol, I'll just talk about two commonly brought up. The first is the red yeast rice.
Okay.
Red yeast rice. Yeah, you can find that over the counter at most pharmacy. Okay. Do you know why it works? We know we know why it works.
Why?
We know it works.
Okay.
But do you know why it works?
No.
No. Why?
Okay, so they take the yeast and then they ferment the rice,
Okay.
and then they extract it and find that actually it contains this substance called monocholine.
Okay.
And there are many monocolines in the extract, and one of the most potent monocholine is monocholine potassium, monocholine K, and that's identical to lovastatin, which is a prescription statin.
Oh,
Yeah.
okay.
So what you're taking is the same effect as you're taking a statin.
Wow.
The side effect profile is the same.
But
and
one
there's
is
no-
a natural source.
It's a natural source.
Right,
Yes,
okay.
but there's no. This just caution here because the commercially prepared red yeast rice out there, they vary greatly in terms of the content the efficacy. Yeah.
So it's more processed, that's why, maybe. That's why it's a bit different.
I'm sure
Is
that
that what you're
pure-
saying? Wait, is red yeast rice the same as red rice?
Is it rice?
No,
it's not. Okay.
no.
So is
It's
it a
not ferment-
liquid? Is it a powder? How does it come?
I think they, like I said, they ferment it using yeast, and then they extract it. I think then they process it into a capsule.
Capsule, right? Okay.
Yeah.
Oh, I see.
That's right. yeah.
Okay.
Okay, so it's not something
So-
we can cook or
No,
Yeah, that's
no.
what I was thinking.
red
So it's
yeast rice.
so it's not 100% natural. Right?
Well,
Because it still has to
I
go
think,
through
I'm
some
not
processes.
Yeah, I think so. yeah.
Okay.
The other one is commonly brought up is omega-3 fish
Yeah,
oil
fish
or
oil.
cod fish oil.
Okay.
Olive
Yeah,
oil. Okay.
that's right.
I've heard of that.
Yeah, that helps to lower the triglyceride, which is one of the components of your lipid profile test, but it has no impact on cardiovascular risk. No impact. Cardiovascular mortality, morbidity, no impact at all.
Okay.
Yeah. So you
Alright.
take it will not lower your cholesterol. You will not lower your risk.
So what will it do? It doesn't do.
No.
But people
yeah.
commonly think that
Yes,
omega-3 is
That's
right.
right.
Okay.
Yes, yeah.
Okay.
Okay, now we know.
Yeah.
Yeah.
So it's a medical myth then.
You know, at the time I wanted to
Oh.
go out there and buy omega-3, fish oil,
Yeah.
right? Ended up buying, you know what? Shark liver oil.
Oh. Okay.
Because I wanted something a bit better and stronger, right? The guy convinced me, shark liver oil. Why go for cod liver oil when you can
You
have
have
shark
shark-
liver oil?
Right.
I paid $250, right?
That's the
for
one you were talking about. Yeah.
And you know what?
My
I took
goodness.
it once. I didn't feel too good after that.
Why is that?
So I
Doctor?
threw it
Do you
away.
know? I mean, is there something in there that would affect anyone? Would you know?
No, I
No,
wouldn't.
you wouldn't know.
I don't
Okay.
even believe they were selling shark liver oil.
Call them out, man.
Yeah.
I'm not going to say where I got it from now. One of the leading pharmacies here in Singapore.
There are not that many as well.
Yeah, exactly.
Okay, should we talk healthier SG?
Yeah,
Yeah,
I
because
think we will.
Hey, wait, but before that, I mean, we can talk about healthy SG when we go on the radio in just a while.
Okay.
I have one more question regarding hypertension.
Okay.
Because recently Tina Turner passed away.
Yeah.
Yes.
Right? And
Yes.
and I remember reading the article and she said, I mean, when she came down with I think it was her kidneys, if I'm not mistaken, her kidneys and her liver, I think. She said she should not have ignored her doctor's warnings about her high blood pressure. So she attributes her organ failure, so to speak, to the fact that she ignored
Right.
what the doctor was trying to tell her to keep her blood
Levels.
pressure in check.
Right.
Is there any truth in that?
Yes, definitely. And this is actually one of the points I hope to address today. Yeah, so another common term of hypertension is also commonly known as a silent killer. Now, why is it a silent killer? Because vast majority of people with hypertension do not know that they actually have hypertension because it has no symptoms. You can be having a blood pressure above 140/90 for years, and yet you still do not feel anything. You do not know you have it. But during that persistent exposure to this high blood pressure, actually damage is done to your target organs like your heart, your brain, your kidneys, your vessels. And then by the time you present with target organ damage like what you mentioned, like heart failure, stroke, ischemic heart disease, it might be too late to reverse all the damage. And the same goes for cholesterol as well. No symptoms. All my patients with cholesterol have no symptoms. They don't even know that they have high cholesterol until you come in for a blood check. Yeah, so I think that it's timely that we talk about healthier SG because this is where you can actually proactively,
Yeah.
take active steps to take charge of your health.
Yeah.
Yeah.
I just want to find out something. I mean, we speak about high cholesterol. Is there such a thing as low cholesterol? Is that a thing at all, or is it okay to have?
That's not really a concern.
Okay,
Yeah, there
so
were
it's
some concerns back then, but I think so far there hasn't. It's not a major concern.
Okay.
In fact, the lower your LDL is, the better.
Oh, so low cholesterol is
Yeah,
what
it's
you're
bad.
aiming for.
Yeah.
Okay,
Yeah, yeah.
all right, okay.
Okay, let's go on air and we'll dedicate this next talk set, which will
To
be the
healthy
last talk
SG.
set, to healthier
Healthy
SG.
SG.
We'll talk about it at greater length.
Yeah.
Okay, stand by.
Young Metro don't trust you.
Kiss 92 traffic.
A couple of situations to pay attention to on the SLE towards the CTE after the Woodlands Avenue 12 exit. An accident has been spotted. Same thing on the KPE towards the ECP. Avoid lane 3. This is before the Nickel Highway exit. Yet another accident there. If you have any other news about what's going on on the roads, WhatsApp us at 88550920.
Thank you for that, Angel.
You're welcome.
We're back on The Big Show and The Big Show TV. It is Good Morning Doctor Day, and we certainly hope you're enjoying the show today. We've got a very cool doctor with us, family physician from Parkway Shenton, Dr. Daniel Chow. We hope you're enjoying yourself, Doctor.
Certainly.
Not too painful, right?
Love
Not too
my time.
painful.
No.
Okay.
Yeah. Well, it's worth it waking up early this morning.
All right.
Thank you.
you.
Thank
You know,
you so
not
much.
all radio DJs will make you feel this comfortable.
Yeah, this
Yeah,
is true.
yeah.
This
It's
is
just
true.
because we're pro like that.
And
Yeah.
you know what? This is his first time on radio, right?
Yeah, that's right.
We're kind of bringing that benchmark quite high.
Yeah.
So
You've been fantastic, Doctor. You've
You
been
have.
fantastic.
Yeah.
Okay, so we've talked about high blood pressure. We've talked about high cholesterol. Now let's talk about healthier SG, because this is something that, I mean, we've had Ong Yi Kang on the show
Yeah.
before.
And he
our
spoke
health
about it,
minister.
yeah.
He's spoken
and,
about
and,
it.
and he loves it when we talk about healthier
Yeah.
SG.
yeah.
Now, I'm probably the only. I don't think you have. You guys already appointed your
No, not me.
Appointed your what?
your official doctor.
Well, I don't.
I already
Do you
have.
have to like officially appoint them?
I registered. I appointed
Oh,
my.
you have to
my-
register.
yes.
No, I have someone that I go to all the time, but I haven't registered him.
But first, maybe we can ask Dr. Chow,
What
what
is-
exactly is healthier SG?
What is it?
Okay,
actually?
Healthy SG is an initiative by MOH to encourage and empower Singaporeans to stay healthy and to manage your chronic conditions well with a trusted family clinic.
And
So
it's
it's
about
only
being
for
pre-
chronic conditions.
No. It applies to all Singaporeans and permanent residents aged 40 and above.
And
Yes.
what Healthier SG is really encouraging is preventative
That's
more
right.
Yes.
than cure,
Yes.
right?
Yeah, absolutely.
Yes, that's right.
Okay.
Absolutely.
Because it's always good for a family to have their family physician.
Yes,
so to speak,
absolutely. He
right?
knows your history and everything else. Yeah.
Yeah.
Can anyone? How does one get involved in this?
Okay. I will. Okay. To people listening out there, I will just categorize into two groups of people. The first group of people are people who really have existing chronic conditions. You're probably already on follow-up with your own trusted family doctor. And if you belong to this group of patients and you're 40 and above, Singaporeans and PRs, then you can just check with your clinic, your regular clinic doctor, and if he's already enrolled.
Yes.
Is he already registered with Healthy SG? And then he can help you to enroll.
Right. Okay.
Yeah,
Okay.
That's right. So, for example, Parkway Shenton is a Healthy SG registered clinic.
Yeah.
And then I believe our patients out there, you've been receiving calls from our staff to encourage you to enroll. Yeah.
So,
and you can start. You can start now. You don't have to wait until it's the launch of the Healthy SG.
Right.
So
Yes.
what if your doctor is not under the Healthier SG group of doctors then, or clinics?
You can choose to. So it's voluntarily. You can volunteer.
The doctor.
Yes.
All right.
As in you can choose to enroll or not. Yeah. If you choose to continue with a non HSG registered clinic, then it will be business as usual. You will not enjoy the benefits that come with the initiative.
Okay.
Yeah. Or you can try and persuade your
The
doctor,
doctor
to
And what are
the
some of the
benefits?
benefits?
I was about
that
to
you
go
get?
like, I always ask
Yeah.
the hard questions sometimes.
Yeah.
You know, why would a clinic not be an HSG clinic?
Yeah.
Well, maybe. I'm sure there are various reasons, but it's up to the doctor to decide, because there are some logistic and administrative things that they have to do, and also they have to see their patient profile, if it matches with the patient they're seeing, whether it
Makes
they want
sense
to
for them.
makes sense for
Yeah.
them to register.
Okay.
Yeah, so I think it's an individual business.
Okay. Doesn't make the
yeah.
doctor any less
No,
qualified or
It's a
anything
business
else.
model.
No.
So what?
Yeah.
So
You're
what
not
are the
short-term.
benefits of doctors or clinics being on HSG?
Well, first of all, is when you see the doctor, he will develop a personalized health plan for you, which includes vaccinations, recommended vaccinations, regular health screening and follow-ups, and then the doctor will through the consultation, you learn how to take preventive steps to take charge of your health, and then get connected to fitness and health talks that are managed by community partners like Sports SG and Health Promotion Board. Yeah.
Okay.
There's also money to be saved, isn't there?
Yes, there's money to be saved, and this, for the patients with chronic medical conditions, I think from next year onwards, there will be the medications will be subsidized.
Oh, okay.
Yeah, that's right.
And accordingly, from July, which is just this Saturday,
Yep.
your first consultation at your enrolled clinic is absolutely free. You can access your medical bills, your reports, and your track health trends via your My Health 360 app.
Yep.
There's also $20 worth of health points after your the first health plan consultation, and free nationally recommended screenings and vaccinations. All that is happening from July, which is just around the corner.
Yeah, it's very, very
Lots
cool.
of stuff happening.
Healthy SG is very, very cool.
I like you, Dr. Chow. The thing is, I'm thinking, I used to go to my uncle. My uncle's a GP, but he just retired because, he's
Okay.
like 85, 86 years old. He just retired. So I don't have a family physician
Oh,
right now.
get
no.
one.
Okay,
Yeah.
so you should get
I
one
want to
that's
go look for Dr. Chow.
enrolled. Yeah.
Where's your clinic, by the way?
Clementi.
Oh, Clementi. Okay.
You're welcome.
Clementi, yeah?
Clementi is not
Yeah.
far from anything. Yeah.
Yeah, that's
if,
fine.
If you come, you're going to attract a crowd to my clinic.
No.
And you know what? Dr. Chow is saying, please come, Glenn. I'll take a picture and put you up there.
I will come to you. I will
Okay.
come to you. I really do need a family physician.
He wants your
Yeah.
business, you know that. Because it'll help his business.
No, but I feel like, it's a relationship with
Of
your
course,
doctor as
yes,
well.
yeah, you
all
need to
those
get
years
along
with
with
my
him.
uncle, that's a very close relationship.
Yeah.
It is.
I feel like, Dr. Chow is a nice guy.
Okay,
I
all right.
can develop this doctor-patient relationship.
Glenn
with him.
on coming your way, Dr. Chow.
All right, Dr. Chow. Thank you very much, Doctor, for being with us this morning. I'm sure our listeners are very, very thankful for your advice today.
Yeah.
Absolutely. This is the first of our weekly Wednesday Good Morning Doctor sessions. If you have anything at all, any burning health questions, any topics that you want us to talk about, all you have to do is WhatsApp that in to 88550920, and we'll try our very best to get a doctor that will specialize in what you want to hear.
Yeah, I've got the topic for next week, though.
You do?
I don't
Okay.
have the
Okay.
name of the doctor who's coming in
right.
to be with us.
What are we
But
talking about?
next week, we'll be talking about diabetes and eye care.
Oh,
okay.
That's,
Okay.
Yep. Interesting
So,
topics.
Remember, go spread the word every Wednesday, 8 to 8:30. Good Morning Doctor on KISS 92. Once again, thank you very much, Dr. Daniel Chow.